So this one here I was talking about after the delivery of the baby, we say postpartum care. After the delivery, we has to check we has to assessment the mother during the postpartum period. When we go for assessment, right, what we have to check and how we have to memorize it. First of all, we has to check the bladder, means urinary bladder, right? And when we check the urinary bladder, we check is it distended or not. Also, we encouraging mother to voiding, because if mother does not void, hold the urine, the chance of develop UTI. So even before assessment, tell the patient to void. And then we have to check the uterus. Usually after the delivery, the mother's uterus is firm. It is firm. Firm means the muscle look like the muscle. If you hold your biceps muscle and if you touch the muscle, feel like firm. And also the level of fetus up to the umbilicus, just immediate post-operative, post-delivery. So I said uterus should be firm and it is at the level of umbilicus. So then we go to check the breast. Then we go to the check the breast, check for any kind of engorgement or any mastitis, means inflammation, mastitis, or we have to check any kind of crackles nipple. So now I said crack. So here then we have to go for the check the bowel sound, right? Assess for the presence of the bowel sound. So if we get and check the bowel sound is there, means the peristalsis movement is. When we have to check the bowel sound, we put the stethoscope around the umbilicus or just up to the right of umbilicus, so you can get the bowel sound. So if the bowel sound is present, it indicates the bowel movement is normal. There are no sign of paralytic ileus. So then we have to check the lochia. Lochia, if too much discharge, right, it is indicate any kind of pathology. So if the more than 8 pet per day, it is indicate the excessive lochia secreted. And episiotomy, we have to check any kind of inflammatory change in episiotomy. So basically, this is the birth canal, right? In the picture, you can see the first picture. This is the birth canal and this is the anus. If we extend direct to the anus, this is the dangerous, right? So I said if during the delivery, sometimes it is hard to deliver the baby's head. So to get easy to delivery of the head of the baby, we do the episiotomy. But we do not cut the birth canal to direct to the anus. We do not do. What we do, we cut little bit lateral, not direct or midline. Usually we do not do. We do little bit lateral side, lateral. So this is called episiotomy. After do the episiotomy, why we do the episiotomy? To facilitate the baby's head delivery. um, After episiotomy, we have to check any kind of inflammatory change of episiotomy, like redness, edema, any kind of blood clot spot, or ecchymosis, any kind of discharge or drainage. So because this is the sign of inflammation: redness, pain, tender, increased local temperature, all of this, or edema develop. And also here is important to check the any kind of a positive sign for DVT, means deep vein thrombosis. And deep vein thrombosis can cause the pulmonary embolism develop. So deep vein thrombosis, it is coming from the lower extremity. So if mother has a complaint of the pain on the leg muscle, all right, or if we see the redness in the calf muscle, means the chance of develop the blood clot formation. This simple clot, when traveling to the microcirculation like pulmonary system, this is a microcirculation, and then they fall in stack and develop pulmonary embolism. And this pulmonary embolism is a life-threatening medical condition. So a simple test can exclude the mother has a deep vein thrombosis or not, right? So I said we have to check the calf muscle for deep vein thrombosis. How we do this? Uh, we have to hold the heel one hand, another hand we has to hold to the toes, and then push a pressure towards the knee. This is called dorsiflexion, right? In case of dorsiflexion, if mother complain about the pain in the calf muscle, it indicate the develop chance of develop the deep vein thrombosis. And this simple test is called Homan test, Homan sign test, right? So it is showing the Homan sign test. We has to check this muscle pain. So Homan test, if positive, then we encouraging them to ambulate, or we encourage them to use this kind of special device. It is pneumatic compression, pneumatic compression device, we said. And also keep in mind, sometimes we prescribed the blood thinner and prevent the complication. So what are the next? Also, during the assessment, we do take the assess for emotional status of the mother, because chance of develop to depression or postpartum blue. So how easy way to remember? It is called bubble E. B stand for bladder assessment, U stand for uterus, B for breast assessment, B for bowel, L for lochia, see the excessive secretion, E stand for episiotomy. And also we have to check the deep vein thrombosis developed by Homan sign, very important Homan sign. And finally, emotional assessment. easy way to remember bubble he. So